Hello, my friend. If you're over the age of 70, or if you have parents or loved ones in that age group, this video might be one of the most important ones you'll ever watch. Today, I want to talk about something we often don't hear enough about. The medical procedures that may actually do more harm than good after a certain age. Now, let me be clear. This isn't about telling you to ignore medical advice or skip out on caring for your health. Quite the opposite. It's about smart aging. It's about making informed decisions. It's about understanding that what worked when you were 40 or 50 might not be the best choice when you're in your 70s or beyond. And more importantly, it's about living better, not just longer. Because here's the truth. Just because a procedure exists, and just because it's offered to you, doesn't mean it's right for you. Especially in later life when the risks of complications increase, and the benefits sometimes decrease. So today, we're going to go through 6 common medical procedures that doctors often recommend reconsidering after age 70. We'll explore what they are, why they might be unnecessary or even harmful, and what questions you should ask your doctor before saying yes. This video isn't about fear, it's about freedom. The freedom to make empowered, informed choices about your body, your health, and your future. So grab a cup of tea, settle in, and let's talk like friends do about how we can age wisely. Let's start with a big one, colonoscopies. Now, colon cancer screenings are extremely important, no doubt about that. For many people between ages 45 to 75, regular screening can catch issues early and save lives. But after 75, the story begins to shift. Here's why. Colonoscopies are not without risks. They're invasive. You have to be sedated. Your colon has to be emptied beforehand, which can be hard on an older body. And sometimes, complications like bleeding, dehydration, or even perforation of the bowel can occur. According to the U.S. Preventive Services Task Force, routine screening is not recommended after age 75 unless there's a specific concern or strong personal/family history. So if you're healthy, have no symptoms, and have had normal colonoscopies in the past, you may not need another one. The takeaway? Ask your doctor if the benefits truly outweigh the risks for your case. Don't just go on autopilot, because after 70, what we really want is quality of life, not unnecessary procedures. Fellas, this one's for you. The PSA test, prostate-specific antigen, is used to detect prostate cancer. For many years, it was almost automatically ordered for men over 50. But here's the catch. Prostate cancer often grows very slowly, and many men will live full, healthy lives without ever needing treatment, even if cancer is found. After age 70, the chance of dying from prostate cancer is relatively low. But the treatments, surgery, radiation, hormone therapy can have serious side effects: incontinence, erectile dysfunction, fatigue, and more. So the question becomes, should you test if you're unlikely to benefit from the results? Many doctors now say no, especially after 70, unless there are strong symptoms or risk factors. What's better than overdosing? Shared decision-making. Talk to your doctor about your overall health, your goals, your risks. Don't be pressured into testing just because. Remember, more testing isn't always better. Sometimes less is wise. Ladies, let's talk about mammograms. These are essential screenings for breast cancer. But as with other screenings, age and health status matter. Many medical organizations, including the American Cancer Society, say routine mammograms should be reconsidered after age 75, especially if a woman is in poor health or has a limited life expectancy. Here's why. Breast cancer in older women often grows very slowly, and the emotional and physical toll of biopsies, treatments, and false positives can outweigh the potential benefits. If you're in great health at 75 or 80 and your doctor agrees, it might still be worth doing. But if you're dealing with other serious conditions, or if the detection wouldn't change how you want to live your life, it may be time to stop. The key again is personalization. It's not one size fits all. Ask yourself, would I want treatment if something was found? What are my priorities at this stage of life? Because when we think not just about living long, but living well, we often make better choices. Now, this one's a bit more technical, but really important. As we age, heart disease becomes more common. Chest pain, shortness of breath, those should always be checked. But here's the truth. Not every blocked artery needs a stent or surgery, especially if you're not having strong symptoms. Research shows that for many older adults with stable heart disease, lifestyle changes and medication can be just as effective as procedures like angioplasty or stenting, and with far fewer risks. Stents are amazing when someone is in the middle of a heart attack. They save lives. But doing them in someone who isn't having symptoms? That's where things get murky. After age 70, the body is less tolerant of surgery, anesthesia, and recovery. So doctors often recommend a more conservative approach, unless there's clear evidence that a procedure will help your symptoms or function. So, if your doctor recommends a heart procedure, ask, will this improve my quality of life? What happens if I don't do it? Are there less invasive options? Don't say yes until you feel fully informed. Joint replacements, knee and hip, can be life-changing. For the right person, at the right time, they offer freedom from pain and a return of movement. But after age 70, especially in people who are frail or have other health conditions, the risks can start to outweigh the benefits. Surgery involves anesthesia, hospital stays, rehab, and sometimes complications like blood clots, infections, or long recoveries. If you're healthy, active, and motivated, a joint replacement might still be a great choice. But if you're already having trouble walking or standing, and especially if your muscles are weak or you have other illnesses, the outcomes might not be as great as expected. Some people never fully recover after surgery. So again, talk with your orthopedic doctor. Ask about alternative pain relief, physical therapy, or joint injections. Surgery is not the only path. The goal isn't to fix everything. It's to preserve your function and dignity. Lastly, let's talk about something that sounds good but often isn't. You may have heard of full-body CT scans, executive health checkups, or total body MRIs offered at private clinics. They promise peace of mind, but often they deliver unnecessary stress, false alarms, and costly follow-ups. Here's why doctors often don't recommend them, especially after age 70. They can detect incidental findings that aren't dangerous, but now need more tests. They expose you to radiation if using CT. They can lead to anxiety, overdiagnosis, and unnecessary procedures. In short, more testing isn't always better. If you're feeling fine, staying active, and seeing your doctor regularly, there's usually no reason to scan your whole body just in case. Instead, focus on targeted, thoughtful care, guided by your symptoms and your medical history. Your time, money, and peace of mind are valuable. Don't waste them on tests you don't need. My friend, if there's one thing I want you to take away from this video, it's this. You have the right to say no. You have the right to ask questions, to get second opinions, to slow things down before agreeing to procedures. Just because you're getting older doesn't mean you lose your voice in the healthcare system. In fact, your voice matters more than ever. Because good medicine isn't just about doing more. It's about doing what's right for you. Sometimes the wisest choice is to do less. To focus on quality of life, comfort, relationships, and daily joy. That's not giving up. That's living wisely. And remember, aging isn't a disease. It's a season. One full of beauty, wisdom, and meaning. So protect your health, yes, but don't be pressured into unnecessary treatments. Your value isn't based on tests or procedures. It's based on the life you live and the love you give. So rest well tonight, my friend. Keep learning, keep asking, and keep living the life that feels true to you. And as always, if this video was helpful, please like, share, and subscribe. We've got more gentle, wise, and empowering content coming your way. Take care, and may peace be with you.